Hi, I'm Joe Roth. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and informing people about our life-saving mission. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Improving access to mental health. Next on Caucus New Jersey.
Funding for this edition of Caucus New Jersey has been provided by the Robert Wood Johnson Foundation, Felician University, a 21st century education based on timeless values. PSE&G, committed to improving New Jersey's economy and strengthening its communities. MagnaCare, Johnson & Johnson, the New Jersey State Nurses Association, and the Institute for Nurses, advocating, positioning, educating NJ's RNs. And by New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com. And by Commerce Magazine.
Welcome to Caucus. I'm Steve Adubato. You know, the impact of mental illness is felt by millions of people every year, but so many of those same people just aren't getting the help they need. And here in the studio to discuss the ways we can help those who need it the most, we have back with us Dr. Denise Rodgers, is Vice Chancellor of Rutgers Biomedical and Health Sciences and a family practice physician. Marsha I has been with us many times, Executive Director and Chief Executive Officer of the Healthcare Foundation of New Jersey. Dr. Laura Budinick is Assistant Vice President of Behavioral Health Services for Newark Beth Israel Medical Center. And finally, Robert Davison, Executive Director of the Mental Health Association of Essex County. I want to thank all of you for joining us. Talking about mental health, not overall, Marsha. Well, it is overall to some extent, but it's also the need for mental health services. By the way, throughout this program, great information, websites, resources. That's why we're here. Look up that information. It's in certain areas, in certain places, with certain people who need it the most. Talk about it.
Well, I think that everybody needs mental health services, or most of us need mental health services at some point in our lives.
Because?
Because we have stresses in our lives, we have things that happen to us, we have fears, we have hopes that are dashed, we have illness in our lives, and sometimes we need a little help to get over that. The problem is that we don't treat mental illness or mental distress the same way that we treat physical illness or physical pain. So we all know that, you know, if I have a knee that hurts or a hip that hurts, or if I had a surgery and I'm healing from it, everybody understands that you need medical attention for things like that, and that interferes with your ability to concentrate, to do your job, to live your life. But if somebody has a mental health issue, we don't treat it the same way. We think that you have to be strong. You have to just get over it. You have to be macho. You know, but the truth is that it's strong to ask for help. It's not weak to ask for help.
So you lose a loved one. You have this tragedy in your life. And after all these years of talking about mental health, way too many people are not reaching out, Doctor?
Way too many people are not reaching out. And I think that, to echo what Marsha was saying, I mean, part of the issue is stigma. We're getting a little better now. I think there are more people, more prominent celebrities who are willing to come out and acknowledge mental health issues that they have had. But I think that there's still an undercurrent in our society that says it's a moral failing if you just can't suck it up and be okay.
A moral failing?
I think that there are people absolutely who believe that. And I think that certainly as a family physician, one of the things that I've seen over the years is that many people feel more comfortable expressing their psychological distress in physical ways. So people will present with chronic pain, chronic headaches, chronic stomach aches. And when you start to talk to people about what's going on in their lives, you actually discover that rather than being a sort of physical illness, that their mental health issues are manifesting in this way.
I think there's a lot of ways that we reinforce that type of behavior in a community and in our healthcare system. You're allowed to go to the dentist once a year for checkup. You're allowed to go to your primary care physician for a checkup. You don't have to be sick already. You don't have to have a symptom already. Where do you get a checkup regularly, routinely, before you have some sort of mental health symptom? So we've set it up so that you don't really get to go anywhere until you have an illness. You've hidden it for so long because of the stigma. Now it's very acute. Now you haven't told anyone about it. And now you're stuck in a place where, how do I get access? Who do I tell? Who can I trust? You go to your primary care physician often because that is the relationship we have in our society. It's the doctor-patient relationship. It's trusted. What we have to do as mental health people is borrow on that trust and integrate into that care setting.
I think that's 100% correct. And one of the reasons that this show is so important is we need to send the message that mental illnesses are real. Depression is a biological illness, just like hypertension.
Biological. I'm sorry to interrupt. Just like hypertension?
Absolutely.
Right.
Not dramatically different?
Not in my judgment. It's a medical disorder. Mental illnesses are real. Treatment's available. A lot of people don't realize that. The prevalence in recovery from depression is actually higher than hypertension. And recovery is possible.
But back up for a second. So why is it that you go to your physician and one of the first things that gets tested is your blood pressure? No questions are asked about your mental state.
Well,
We're
that's
trying
changing.
to change that.
Exactly.
We're all trying to
what would
change
you
that.
ask?
Changing. Oh,
Marsha, what would you ask?
Well,
I'll come back to
that's a
Dr.
better question for Dr. Budinick, but there are screenings that you can do, and that's why Dr. Budinick at Newark Beth Israel Medical Center, where she works, and the Healthcare Foundation of New Jersey, where I work, are talking about doing programs for integrated primary care.
Such as, explain it.
In
Break it
other
down a little
words,
bit.
you go to the doctor, and in addition to being asked about your blood pressure, you're asked certain key questions that can red flag whether you have a mental health issue. If I'm stating it wrong, correct.
Keep going.
And when that screening instrument is read by somebody in the primary care practice, they may say, oh, this person's fine, or they may say, maybe we should investigate further. And so somebody else then, who is a social worker, a licensed clinical social worker probably, or an advanced practice nurse who has a psychiatric background, would then sit down with you and explore further what your issues might be.
But I'm going to even add a step to
Jump
that,
in.
and this is what Dr. Rodgers and I have spoken about, and it's so important that not only does the primary care physician or whoever the medical provider is at the time recognize the screen, they have to start the dialogue with the patient because that's the relationship. So part of our role is to educate the primary care physicians,
To do
the
what?
residents.
To have a certain conversation?
And to be comfortable in it. Because we have a scope of practice that keeps us from being comfortable.
The scope of practice, with all due respect, that sounds jargony to lay people. Scope of practice means what? This is what we do, and outside of that scope, we don't do it?
This is my area of expertise, and I'm very comfortable with it. And then once you have maybe an issue that's outside of what I feel I'm expert in, I'm going to refer you out. And what the patient experiences is you don't know how to take care of me, I'm being rejected, and you think there's something wrong.
So I think that as a family physician, part of my training included a significant amount of actually behavioral health training. And so
Is that the exception or the rule?
that is the rule. It's certainly in family medicine and in general internal medicine as well. And I think increasingly in pediatrics. I mean, I think that there are screens that we do. And so it's very important for us to not sort of lump all mental health issues in sort of one basket saying everybody needs this kind of service. In my practice, I treat people with depression. There are people who have a level of depression that's appropriately treated at the primary care level, just like there's a level of hypertension and diabetes that's appropriately treated at the primary care level. What we need to do is two things. One is we need to make sure that people are adequately trained so that they're skilled in doing it. But one of the big barriers to having it happen in primary care is that the reimbursement system
Insurance reimbursement.
Insurance reimbursement works against me doing that because I now am valued for how many patients I can see in a certain amount of time as opposed to the quality of what I'm doing. And that is one of the most significant changes that has come with the Affordable Care Act, which is we are now moving toward more value-based care as opposed to counting widgets. As that happens, patients will then, I believe, get a better opportunity to get a level of depression treated in primary care, but similar to heart disease. So there's a certain level of patients I treat with heart disease, but then patients get more complex. We need to then ensure that they get access to appropriate mental health services. And if you're poor in this country, that becomes enormously difficult. And even if you're not poor, with some insurance, commercial insurance plans, it becomes enormously difficult.
Stay on the socioeconomic part of this. Marsha, we've talked a lot about this offline as well. With your foundation, the foundation you head up, Newark particularly important. Talk about some of the mental health issues experienced by students that you've learned by engaging principals in schools, public schools, and how that relates to this whole discussion.
Sure. Well, kids who grow up in Newark are often exposed to a great deal of trauma. They are exposed to stress. They're exposed to violence on the street. They're exposed to violence sometimes in their homes. They can't go out and play on the street freely because their parents are worried that it's not a safe environment. Often they can't, walk to school without people there, adults there to help them. So they come to school with this tremendous stress that's built up. And it's very hard for them to concentrate sometimes. It's very hard for them to learn because they're dealing with all of these issues. Maybe they're being raised not by their parents. Maybe, there are all kinds of reasons. But they get to school and they really need help.
What do the principals tell you, I guess a funders group? I'll get to you in a second, Bob. What do the funders, a group of funders, philanthropic organizations, what did they tell you? Newark Funders Group, what did they tell you they needed?
The Newark Funders Group did a survey of school principals, a dozen or more school principals, and asked them what their #1 priority would be for the following year for funding from the philanthropic community. And they identified mental health supports as their #1 issue. #1 issue.
They've reached out to us
and they
several
recognized, they did that because #1, they're having difficulty handling situations in their schools. Their teachers are having difficulty handling classroom situations, and they recognize that their students are not going to be able to achieve unless some of these issues are met and overcome. And so the Newark Funders Group got together and together allocated more than $500,000 for a number of Newark schools to help deal with those issues.
And if you think about it, it's not just the child who's exposed to the trauma. The school is a small community. That classroom, if one child is reacting to stressors and trauma in their life, they're impacting every child in the classroom through the behavior.
Bob, I want to do this because, Bob, your organization is involved with veterans as well.
Yes.
All right, let's do this because there are students in Newark. There are people who are feeling the stigma themselves. There are all kinds of other people. We're going to go to a quick break right here. When we come back, I promise we're going to talk about that and other issues. Stay with us here on Caucus. We're talking about mental health services, people who aren't getting the help they need. And also, one more thing. We continue to provide valuable information throughout these programs, websites, resources. Use that information. Stay with us. We'll be right back.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD and follow us on Twitter at Steve Adubato.
Welcome back to Caucus. I'm Steve Adubato. Let's pick up this conversation we're having on mental health services. Bob, pick up your point.
Yeah, I just wanted to follow up on everything that Marsha said, which I agree with. And in fact, the Healthcare Foundation of New Jersey funds one of our programs at St. Benedict's High School.
By the way, full disclosure, they're a big supporter of public broadcasting as well.
And one of the things that we found, in addition to the dynamics Marsha spoke about, is the parents, the families. Many of the parents are impaired by addiction or mental illness. And the parents aren't available to care for their children, and they're not available to accompany their children through adolescence. So in terms of working with the child, it's very important to reach out to the family and work with the family to get the treatment that they need, so they're available to support their child.
Do the veterans thing, quick. Where are the veterans? Where are you finding them? What do they need?
Many veterans, most veterans are male. Many of them are young, and that's the demographic that is least likely to seek out mental health services. The stigma is at the highest among veterans, and it's a very difficult population to engage.
Where are you finding them?
Often we find them homeless, unfortunately.
Where?
Penn Station.
In Newark?
In Newark, absolutely.
You go down there and what? They're there?
They're there, and fortunately, New Jersey Transit has actually hired a social worker that we collaborate with, and we've been able to house many of them, but the need is overwhelming and the demand is very high.
Also, Bridges is an organization that
absolutely.
works in that area.
Tell everyone what Bridges is.
Bridges is a nonprofit organization that works in that area to find housing for homeless vets
Great organization.
and vets in danger of being homeless. Yeah, they are a terrific organization.
By the way, log on to our website and we'll connect you to Bridges and others.
Can I follow
then
up with the
I'll go back
vets
to
too?
Denise. Go ahead, yes.
Yeah, the Healthcare Foundation has a Veterans Mental Health Initiative that we've been mounting for the last almost 2 years. We work with 6 or 8 different service providers to reach out to veterans and provide individual counseling, support for family members. One of our grantees is actually working on a curriculum to teach teachers how to deal with kids who are in military families and suffer the stresses that those children suffer. One program reaches out specifically to female vets. And, you know, it's difficult, and the stigma is great, but a lot of the veterans don't want to go to the VA, even if the services are available
They don't want to
in
go
the VA.
there.
They don't want to go there because of stigma. They don't want people to know that they are having these issues.
So stay on this. Doctor, is a lot of this going to where people are as opposed to, hey, you come to where we are?
Yes. Yes, the initial outreach has got to be going to where people are so that we can begin to have conversations with them, so that we can begin, it's as you said, it's about creating relationships. And over time, those relationships can help us to get people to where they can get better care. I mean, it's very difficult to do therapy in Penn Station, but we can do that outreach there, and we can begin to establish relationships and then get people to come to the places where they can get help. I mean, the VA system, for example, for many, many years has been very successful in treating particularly post-traumatic stress disorder.
Right.
I mean, they've done some of the most groundbreaking research on how to treat PTSD. But again, if you have to walk in that door, and particularly have to walk in a door, this is mental health services, you're more reluctant to do it.
A few years ago, 10 years or so ago, I had the occasion to be at a support group in New York for mothers who've lost kids to suicide. And there was a woman there who had 2 sons who were police officers. One of them had committed suicide and the other one was still a police officer. And she said that her younger one, who was still a police officer, that his career had completely stalled because the powers that be in the department they didn't trust him anymore because his older brother had these problems.
They didn't trust
This is the strength of the stigma.
Yeah,
they didn't trust him.
exactly.
Why? Because his brother committed suicide?
That's
But
right.
he was what more likely to or vulnerable?
Well, he probably wasn't more likely
Well, why
to, but
not
they
get him
felt.
help?
But they, well,
Right.
that's a very
the
good
difference.
question.
So even if it is an increased risk factor, and we know that there are risk factors,
Right.
it's not a warning sign, it's a risk that he has, so why not
By
just
having
get
a
him help?
sibling.
Why not get
Yes.
him
So let me ask you about that. To what degree, given this conversation, to what degree do you feel, because you're talking about initiatives that are underway, we're obviously playing catch up, big time. To what degree do you feel we're anywhere close to where we need to be in helping those who need it the most?
Oh, I'm extremely hopeful because I think we know what the models are that work and we have an energy around doing it. And we know that the model is patient-centered, which means you meet the patient where they're most comfortable getting care. We know that. We know that the best care is trauma-informed. And we're starting to put that into all of our trainings. We're starting to
What does that
really
mean?
understand. Trauma-informed means that if you're the provider, you are aware of the traumas in that patient's life or that person's life from their history. So we know that all of the health outcomes in your adult life are closely linked to the number of traumas you had as a child, not current, the childhood traumas. So really as the provider, understanding whether it's medical, whether it's behavioral health, dental, I'm sure even has a place in it. You have to understand where that patient is coming from to really treat them well.
I know this seems like an abstract, somewhat esoteric question, but is there any way to have any idea how many people watching us on public television, Fios, on all the digital platforms, listening to us on radio as well? Is there any way to have any sense how many people watching who do need mental health right now, just don't even have a clue that either they need it or if they needed it, I know this is a loaded question, would know what to do?
Yeah, Steve, according to the Centers for Disease Control, on any given day, 1 in 5 of us have a behavioral health issue, either a mental health
You're
issue
using, I want to be clear,
or
I'm sorry
an
for interrupting,
addiction.
Bob. The word behavioral health, the phrase gets used a lot.
Depression, alcoholism, drug abuse.
Why do we call it behavioral health and not mental health? Is behavioral health a subset of mental health or vice versa?
Vice versa. So
Yeah,
behavioral
yeah.
health is the combination of mental health and substance abuse.
Okay, so
that's
you're
the
saying 1 in
umbrella
5
term.
needs behavioral health.
Right, because there's a close correlation between mental health and addiction, which
That's
is
right.
another show.
That's
Right,
right.
there's a very close correlation between the two. So 1 in 5 of us are any given day, including your viewers, are going to have those difficulties. And 1 in 17 of us is going to have a major psychiatric disorder,
Right.
schizophrenia,
1 in
bipolar.
17.
That's right.
1 in 17.
So watching right now,
Absolutely.
so if we're really to just not be, because we don't like to be, we don't see ourselves as purely an informational show, and Marsha and I have talked about this a lot. As one of our supporters, Marsha doesn't hold back telling us that she wants impact, right?
Right,
Your
right.
board wants impact, as you should. We don't want to just give out information. We actually want to have impact. So that being said, if we actually wanted to have impact, what would we say to people right now watching, or someone who knows someone, or believes, you don't know for sure, but you believe that someone is struggling and suffering? What could and should they do? Not that there's any one thing.
Right.
Some valuable advice, Doctor.
Well, a place to start, obviously, is with their primary provider. So if you have a
Assuming they have one.
relationship, and that's where I was going to go. So if you have a relationship with a primary care provider, I think that is a place to start, and to have that conversation.
Right.
And if
because
you don't?
often they will have resources. If you don't, it becomes more difficult. I mean, I think that there are hotlines, helplines that people can utilize. There are mental health facilities, but often if you're not willing to acknowledge you're having these issues, you're very reluctant to show
How
up
about
at
if
the
you
door
don't
of
know?
the
Sorry
mental
for
health
How about if you
facility.
don't know you're having them, but you think you might, or that someone close to you might?
Go
ahead.
to a friend who seems well informed. Just speak. Go to your teacher if you're a teenager or a high schooler.
And say,
I think I need some help.
I don't even know what help, but I need help.
Yeah.
And if you are the friend, perhaps say to the person who you think needs help, I'm here to support you. You know, it seems like you're having some problems. Do you want to talk about it? You know, can you?
And people, I'm sorry, most people, I'll come back to you, Bob. You don't think most people are like, listen, if I wanted help, I'd ask for it.
I think it depends how you approach them and what your relationship is with them. And if they say that, I'm not a doctor, okay, so correct me if I'm wrong, but my response would be, don't give up on them. You know, respect that, but then,
Always
you
go
know,
back to
follow
it.
up.
Robert?
Right.
Many people with mental health and addiction issues start to feel better when they take action. It is easier to act your way into good thinking than to think your way into good action.
Well, you can't just go by that. Try that again.
It's easier to it is easier to act your way into good thinking than to think your way into good action. I've had people call me asking for help. I make recommendations. The sheer act of making an appointment to see their primary care doctor or to see a licensed clinical social worker, they begin to feel better.
Somehow the
Because
conversation
they're
is
doing
therapeutic.
something.
Because they're doing something.
The conversation becomes therapeutic. It becomes that you're now relating to someone else. You're not so isolated and alone. That really feeds into the anxiety around what you're worried about yourself. It makes it worse.
Can we talk a little
Got a
about
couple
small
minutes, go ahead.
children? Can
Small
we talk
children,
about
go.
small children?
Go.
The Healthcare Foundation, maybe 10 years ago, maybe more, started an infant and early childhood mental health initiative. And we embedded clinical workers into preschool settings to seek out, you know, see who had problems, provide therapy, play therapy, music therapy, engage the parents to do bonding activities, because we felt very strongly, and the providers whom we funded to do this felt very strongly, that if you find issues and you deal with issues when kids are really little, and little kids can have issues,
Sure can.
then you'll be forestalling bigger problems when they get older. And I think that we don't do enough of that as a society.
I can tell you why we don't. There's no reimbursement for
Yeah.
that.
So go
Because
back to the insurance.
Yeah,
Oh,
if you
Yeah.
don't have a disorder or a diagnosis, you cannot have a bill.
Sorry for
related.
interrupting. So in the final moments of the show, you're saying the insurance system is basically set up to not reimburse until there's an identified clinical problem.
Absolutely.
Doctor?
Absolutely.
So what Marsha just described, there's no incentive for more of that.
That's
even
exactly
though
right.
it is
We know it works.
Which is counterintuitive.
And it costs the system more in the long
In the
run.
long run.
We're gonna get now
A few seconds left. Go ahead.
So the few seconds left, I think the thing to remember, though, is if we don't treat these children, they have bad health outcomes as
Yes.
adults, and they die prematurely from
Say that
chronic
again,
illness.
45 seconds left. Life expectancy. I couldn't believe that when I read that.
Lessened
25
if
years
we
left,
do
yep.
not appropriately treat these children with mental illness. They get problems, chronic illness as adults, and they live less time.
How much less are we talking?
We're
25
talking
years.
What?
If
For-
you have
for people
a
with
mental
severe chronic illness.
they tend to have a 25-year shorter life expectancy.
And it's physical illnesses you're talking
and
about.
and
that are
it's physical illness that causes these deaths. This doesn't even
Right.
include the suicides.
Right.
Yeah.
Yes.
Well, I want to thank all of you
Thank you.
for.
Thank you.
What I hope and I'm confident you've just done, which is to help an awful lot of people try to better understand something that affects every one of us, whether we want to acknowledge it or not. Thank you very much.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the Robert Wood Johnson Foundation, Felician University, PSE&G, MagnaCare, Johnson & Johnson, the New Jersey State Nurses Association, and the Institute for Nurses, and by New Jersey Sharing Network. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
New Jersey is a leader in solar power, and PSE&G is doing its part. With 24 solar installations in New Jersey, projects that are giving landfills new purpose and turning former brownfields green. Solar powers more than our homes and schools and businesses. It powers our economy by creating jobs right here in the Garden State. PSE&G, proud to support New Jersey.